Therapy isn't a kick it spot where you and your therapist can kiki, hang out, and you're like old friends that chat about each other's lives. Hi, my name is Dr. Natalie Jones. I'm a licensed therapist. And one of the things that has always sort of come up over the years in working with, other therapists that may struggle with overfamiliarity and boundary crossing with their clients, and also just sort of talking to clients, is that, some people view therapy as like a hangout spot where I'm going to hang out with an old girlfriend or an old guy friend, and we're just hanging out. I'm kicking it. We're not really doing any work in therapy or any real treatment, but it's just a kick it spot. And I've seen this at multiple levels of care, from anywhere from outpatient to partial hospitalization treatment to intensive outpatient treatment, where people just kind of come to socialize and talk to peers because they don't have anything else to do, even though they're not necessarily working on things that are therapeutic, but just because they kind of need an activity, or something to do. And this happens a lot with people that are elderly, maybe vulnerable, and if you have like certain insurance where it's like Medicare, Medi-Cal, and, with organizations, and I've seen it, and I personally have worked in organizations and called into ethics about that, where it's like, okay, we'll just take this patient's insurance and we'll continue to bill and we'll let them continue coming here, even though they're fine. They don't necessarily need this level of care per se, or this type of intervention, but it's it's easy money for us, and that's a guaranteed head count where we can just bill for that person even though they don't really need the interventions we've offered, or they've reached the maximum benefit of treatment and we know they're just lonely, or they just need like an activity, or they just need to hang around people, and so we'll bill for this level of care, which is entirely inappropriate. And again, and this is not speaking to all facilities or anything like that. I'll put that disclaimer out here. It's just some of the things that I've seen over the years where it's like, okay, we'll just come, we'll just hang out, we'll just do a bunch of nothing that has nothing to do with therapy, and we'll write a note on it and say we used a therapeutic intervention and we did this type of treatment even though that never really occurred. So it's just a reminder that therapy isn't hanging out. It's not being cool. It's not talking to your therapist about their personal business. While therapy is a place where you can get support, right? And you can even maybe meet peers where, if you're doing group and things like that, you need to still be doing the work to fix your issue. There needs to be a progressive motion. There does need to be a treatment plan, or you have treatment goals and you're working on accomplishing or treating specific issues. So if you have a mental disorder, you need to be increasing your coping skills or decreasing symptoms and things like that. And those need to be targeted, specific interventions that you're working on. There should also be documented improvements in your treatment, and that, there's also should be document improvements in treatment that you're making as a patient, but there also needs to be boundaries with you as a patient, and you should not be overly familiar with your therapist and know about all the problems that your therapist is going through, what sort of problems your therapist is having in their marriage, and this and that, the other thing, and all this other kind of stuff, where they're just sort of talking to you about that. Even if you're sort of pulling for that information from your therapist should not be giving it to you, because the treatment is about you and not necessarily about the therapist, if that makes sense. So if you're going to therapy and you and your therapist are just talking about, you know, I don't know, like I said, their marriage, their relationship, their kids, but there's not any work being done on your issues, or none of what your therapist is talking about relates to you, or is targeted information that's geared towards helping you progress, there things could be amiss there. And you know, while that there is sort of an interpersonal dynamic that can develop in doing work, especially work where vulnerability is usually tapped into, such as therapy, you still need to be working on targeted things within the therapeutic dynamic. So let me know what your thoughts are, and like, comment, share, and follow. And if you're watching this video on YouTube, definitely give it a hype. Thanks so much. Bye-bye.